Welcome back. We are talking about stem cells this morning, just the research and everything you can do with them now. Well, they can make you look better, they can make you feel better. Dr. Tess is here to tell us this morning about some stuff she is doing with stem cells, and I think what's really cool about what you're doing is you're one of the first people to really be doing this cutting-edge technology in our country, right?
Yes, that's true. I mean, over the last decade, there's been a lot of studies looking at stem cells. And, you know, when we're born, we have about 80 million stem cells in our bodies. But by the time we reach the age of 40, then we're at less than 25 million. And this is part of why we start aging. We're not healing as well. When we get injured, it's like it's taking a longer time. These stem cells, basically, they're like, if you think about it, they're like baby cells. And they can go to areas of injury, and they can differentiate into whatever we need. You know, it could be collagen, it could be fibroblasts, it could be cartilage, wherever. And in the last 10 years, what's amazing is instead of going into the bone marrow to harvest these stem cells, they found out that fat is so rich in these stem cells. And as you know, we've talked about fat and liposuction, and we have easy access to fat, and there's a lot of it. And what they've found is in about a cc of fat, there's about 1 million of these regenerative stem cells.
So what's great is you take those stem cells, and then you can put them somewhere else in the body that maybe is not operating the way you want it to.
Exactly,
right?
And it's a very simple procedure. It's done under local anesthesia, and the reason Rico's here, Rico is my 7-year-old. And then he's also our personal trainer, and he injured his knee, and so and he was limping many weeks, you know, as we were doing our training session. I said, Rico, let's fix it. So we had to find fat on Rico, because as you can see, he's very lean. But it's done under local anesthesia, so it's very safe. He's awake, and it's, you know, just extract a little bit of fat. It gets processed down to these regenerative stem cells, and then we re-inject it. And for Rico, it was his left knee.
Wow.
And within weeks, he's back to, you know.
This is pretty incredible, huh, Rico?
I have pretty severe osteoarthritis from an old football injury.
Okay.
And very little cartilage left at all. And it would swell up a lot whenever I do something too strenuous. And so I injured it about 3 months ago, re-injured it and tore the meniscus. So Dr. Tess said, well, let's try the stem cell thing. And it seemed to work really well. My swelling went away, and it feels a lot more flexible. So I stayed off it for about 1 month pretty much, but now I've been able to work out, do the exercises as well. I do some cycling, some hiking, and it's doing really well.
So does it feel kind of amazing that you were able to take, you know, stuff from your own body basically, put right back into your knee? Yeah, so no reconstructive surgery or anything,
Yeah, the orthopedic surgeon said, well, there's nothing we can do for you. You just got to have a knee replacement, you know. So, yeah, so this is great.
Wow. Tess, what's the response to this so far?
It's amazing. You know, the patients, I never promised results, because obviously results depend on the individual. But for those people who are at the end of the road, basically, and they're suffering, many of the patients that we've treated, they're, you know, elderly who have had multiple knee surgeries already, and they're walking, you know, they need a walker, they're debilitated, they don't have a good quality of life. They want to try it because try something. And
it is hard to think. It is hard to think of surgery. I know when you were 75 and plus, having had, you know, my own relatives go through things, it's hard to, you know, the concept of surgery and, you know, going under something like that. So this could be an amazing option.
It's amazing, and it's really taken my practice from just, you know, the aesthetic to regenerative anti-aging, harnessing our own body's ability to heal and create. I mean, just it's fantastic.
Wow.
It's amazing.
Well, thank you for sharing this update with all our viewers.
And you know, like I said, if you're hurting and you really want to find out what the latest and give it a shot, the procedure itself is non-threatening. It's very safe, even for my older patients, and we have been fantastically surprised at the results.
Well, so nice to have you here today. There, of course, is Dr. Tess's information. You've seen her here before. She also appears on San Diego Living. You can always go onto our website, get more information. But always nice to see you. And you know, we always enjoy the updates you give us on some of the new technology. But this, I have to say, this is pretty incredible.
It is really incredible. And for those people who are also thinking of Tickle Lipo, you know, getting rid of areas. I have a 78-year-old patient who has gained so much weight because she can't move because of her knee injury. She said, get rid of my fat.
And put it in my knee.
And yes, process it.
And so,
3 months later, I saw her just last week, and her abdomen is flat, and she doesn't use a walker anymore. It's like,
incredible.
It's amazing.
All right, Dr. Tess, Rico, thank you for sharing your story. We loved having you in this morning.
Thank you.